I recall that Malcolm at the beginning saying that the forum was deliberately trying to engage new partners, economics, financing. I think we've had a rich lesson in why that's important throughout the entire conference and with your presentation, which leaves us to the last 28 minutes. Um, so there's always a question of what do you do with these last segments? And we decided that we really didn't want to sort of say, well, it's nice and hasn't it been great, but rather we wanted to talk about what's next. And the program planning committee last night was sitting around and, among other things, wrestled with this. I think there's a real sentiment among the program committee meeting was that we would like to go forward with some way. And the question is what that might look like. I'll suggest a couple of things, but really what I'm going to want from this group is the wisdom of the group. Um, what we thought is that taking a leaf from the accreditation workshop, that we could prepare a discussion paper, potentially a paper for peer-reviewed literature, taking what will come out of the repertoire of this document, a lot of the rich discussion and ideas and interplay that we have, and put it in electrons and on the print screen so that we can move forward the discussion. Another idea that came out from Zaray, who's not here today but asked me to bring it up, was that the model gives us a springboard for activity in some areas. And the specific area that she wanted to nominate was that we have in many places of the world and all over the world an information gap between needs and perceived needs. What comes out of a workshop like this, perhaps, is interventions that are directed at that diagnosis. Those are just examples of how we might move forward. What I'd like to do is spend a little bit of time now. If each of you represent your associations, each of you represent your professions, your institutions, your countries, how to move forward, what would be useful in your own context. And I'd like to have a conversation at this stage. Erin.
I just want to add one more thing to your thinking that might help. We were also talking a lot about audience. So who needs to see what we've done over the last day and a half? So who would you put it in front of? Think about that as you're thinking about what the products would be, because I think the audience differs for different product, or the product differs for different audiences.
And what I'd envision would be a brainstorming list here where get specific ideas, we'll put them all up and then sort them out a little bit later. Open it up to the group. Bjork.
Just one thing, I do think policymaker, who, like you said yesterday, I think who's got the juice, who has power to influence, change. And I just wanted to, we just completed a policy brief for that UN Commission on health, employment, and economic development, and we did the education brief. And part of what they wanted, because the audience are policymakers, or numbers is one, but stories is another. And I think one should not, we know we don't have the full evidence. So, and I think that was brought up before, telling examples that illustrate these challenges in a way that is engaging, especially for politicians that, I don't want to say have short attention span, but they have, they want to engage with folks. And these are sometimes easier, quick numbers.
But to flesh it out beyond the kind of abstract, here's examples of demand-supply imbalance in this profession, in this world. This is how it might go, and the stories that go along with that.
And just one addition, try to, because this is happening at global levels, I think the policy brief, I mean, the big report has been published in September, but the policy brief is coming out at the end of October. And there are global events related to it, and they, at WHO and World Bank and others are sort of, organizing all kinds of events. Let's build on those to share what the lessons learned from this particular workshop.
That's a second good idea. Yep, moving over here.
I'm going to speak really to the professions that I represent, but I think that the principle applies. The more that the discussion about needs and perceived needs, of course, is about medical doctors and nurses. There are a lot of us here that aren't even in the dialogue about whether there's a need or a perceived need. You're just off the map. And so in the case of chiropractors, acupuncturists, naturopathic doctors, massage therapists, we internally would look, for instance, at the opioid crisis in the U.S. and say, there's a perception of a great need for use of these folks. If you look at the CDC's policy that just came out, or the Obama strategy that was put forward, or the congressional funding, they don't exist. So how do you, bridge that gap
So
between?
you can use this kind of model to ask that kind of question
Right.
publicly, which is, you've got a need, there's a supply. And
We actually, well,
mismatch.
we prepare for this we have actually a task force for this global forum, and we always do a conference call before the meetings, and really got onto this issue. I think we're going to be probably gestating around a white paper of just sort of making the social case, right? It's not something that's been made that well, I think, by a lot of these folks, and so that's right.
Good.
Can I would just add on to what was said over here. When you're reaching out to policymakers, especially in the states, you want to make sure that your data and your stories are specific to the congressional districts and the states, because that's what they really care about, is who elects them. So you want to make that really specific. And also, I know there's policy briefs, but I was wondering if the best advice I would give is to keep it short. I know that policymakers here get the big reports, and I know there's an executive summary, but you can even do separate materials for policymakers, and you could keep it on a one-pager, and it could even be a one-pager that even if you go to the second page, I know it's simplistic, but it's something that they can look at very quickly and obtain the information and utilize social media to get that to them, to the offices, because most of these congressional offices get that information through social media. Snail mail is kind of old in that world right now, believe it or not. So
Ideally with a graphic.
Yeah,
Your one pager is mostly graphic,
you can
right?
take the whole thing and slap it in a graphic, even better, and focus it on their state and district. It's
Good.
gold.
This is a lobbyist.
That's right. That's right.
Two things. First, let me just respond to John. And I think what we don't do is leverage what's available. And I'm thinking about the Defense Veterans Center for Integrative Medicine, because we recognized in the Department of Defense, way before it was public, that we had an opioid crisis. And so we started the integrative medicine. And we are working with Jonas Foundation and others to get that science, I wouldn't say traditional research because it's hard to do, but to get that science out. So I think we have to look at how we cross-leverage stuff that's there that we are not aware that's in another segment. But I would like to return to what I mentioned yesterday, and I think it's something that in higher ed that is just largely ignored, and that is the cost issue. And if this group, with the leadership that it has with universities across the country, could identify a way to look at what it is that what does it really cost us to do what we're doing, and have some way to look at comparative data. Because I think everybody uses different costing models, and the one that I mentioned yesterday, the activity-based costing, actually came out of the insurance industry. That was what was funded, and so I'm not saying that's the only model, but I'm just saying that if we identified one or two models that this group would recommend. And then I really think that he hit on a huge one, which is separating the training/education cost from the research cost. And so that would allow us to have more common, I'm thinking of Health Sciences Center where I've been a dean. And so how does my training cost, if I pocketed the research cost over here, how does my training cost compare to another school within the state that might be producing the same thing I'm producing without the research investment, because the mission is different. So I just would like to see us take a leadership role and saying that you can't ever get to economics and finance if you don't identify what it costs to do it. And we have just ignored this in a blind way unless our state required us to do it, and a few of us have been there. And I just think this group could take the leadership role in identifying 2 or 3 models and trying to get people across the country to do that.
I think that's one of the things that impresses me about, I spend my life, as some of you know, I've taken up politics for Lent, and trying to get a bipartisan approach to something. There's very few things that they agree on publicly, but one of them is cost. And we are so sloppy in our language and our thinking about cost because we've unhinged price from cost and made it all muddy. And I really, really agree with you. Other ideas for steps forward? Mary Beth.
So when you ask the question about how would we use this, and then we look at who the audiences are that we want to get it to, I think another way to do this is to attach it to what people are already doing. And, staying within the profession of nursing, the Macy Foundation, I think Steve is not here anymore, is releasing a paper talking about RNs working in communities because it's a huge gap on a lot of different levels, which you'll see with the paper. But, again, saying, now we have this model, you have a mismatch here that you're talking about. And I think all the professions here have these papers that have already identified all these mismatches. So how do you take that paper and then run the model?
So, and I love this. I think in some ways, there's 2 ideas that come out of one of is using this model as almost a tool for analyzing potential policy. But you've also added another element of this, which is there's lots of groups that are now publishing fundamental papers, often without a more rigorous economic or health labor markets aspect. And it's a very easy commentary at some level. I don't know if that's, I don't want to, is that what you're, yeah? Good. Do this side of the room. Joanne.
Thanks. I appreciate you bringing that up, and actually several of the other comments intertwine with what I have been kind of brewing in my mind listening this morning. All the health sector spending is essentially it's investment in populations, it's investment in health, and so on. But it is also opportunity cost, pushing other things aside. Several months ago, Marilyn Chow recommended to me a book called Shock of Gray that really does a nice job of illustrating how spending and investment in healthcare needs push other productive activities out of your economy. So it's like, yeah, you're spending $1 on, delivering home doctor visits again, or whatever it is. You could have actually built something with that money or that time, or, it's like that doctor could have been an engineer building something that, maybe we don't need our iPhones, but something that we, there's that. So I always am trying to think, what could you be doing with that money otherwise? But there are a lot of deeply vested interests in the money continuing to flow as it does to academia, to the research enterprise, to the guilds and professions and so on. And that's very much counter to those principles that aren't on the screen now, but were earlier, that Erin was walking us through the revised underlying principles. So as I'm thinking it would be interesting to explore, so what are those principles that seem to be a lot of consensus around? Ideally, financing should be driven by that. What are some concrete examples where financing systems, there they are, where financing systems have actually created the right incentives and the right carrots to align with that? And I'm pretty sure it's not the US health education and financing system right now, or maybe there are subsectors of it that are, but where are those examples? And can we put those forward as perhaps either exemplars or discussion opportunities?
So then the notion would be the product would be identifying those either in individual industries or locations or countries and saying it is possible to follow these guiding principles, and here are examples and how can we get there.
Exactly.
Frank.
Well, I have actually two comments. One is the one leadership that's extremely important is the academic leadership in academic health centers and health professional schools as they deal with this collectively. In my environment, the University of Michigan, where I'm dealing with interprofessional education, we have the attention of all the officers. And so we now can make that collective argument, and we're getting students together so that they can have the interface that we've been suggesting here, including our School of Public Health and dealing with finances. So you're getting those collisions of intellect going on at an important point where you're shaping students. And we've got a lot of stories that other health professionals have also had. So I think that's an important group. And these types of documents with the credibility of this association, they pay attention to. And so it's very useful that way. The second part, when we were talking about the principles about collaboration, I'm reminded, since I'm at a research institution, that we've gotten very collaborative in our research. Part of it is because our external funding agencies have said that. And so in a competitive environment, we collaborate on necessity. So there are examples of how higher education does get together and gravitate, and those of us that have been in those fields migrated from our single cell to a multidisciplinary environment
or whatever. Yeah.
Yeah, and so it is possible, is what I'm saying, where they can change. It's the mechanism.
Given the right lever.
Exactly.
Yes. Yes, ma'am.
Well, I would say that when we had the Bellagio Conference on Empowerment of Women through Nursing and Midwifery, we used this financial lens, and we identified specific examples where investors were investing in specific education for a specific purpose, and to then make it entrepreneurial for these nurses or midwives to go into an entrepreneurial practice to meet the needs of the community. So I think we
Kind of exemplar that
right. So
Joanne was.
we do have from that report some very good exemplars that meet these guiding principles.
They're global.
And that are global. I think our difficulty from that conference was how do we apply that to the United States? And I don't think we got very far in that conversation of how do we now take that and apply it to our particular setting. And part of it is what's been brought up by the World Bank people is the regulation, right? If you have the stranglehold by medicine on the practice of who's going to do what, and we also have every state, it becomes very difficult to take that franchise model, and you need that franchise model to go widely. You have to do it within a state, or you have to manipulate 5 or 6 or 12 state regulations regarding nurse practitioners, midwives, whoever, right? Whatever it is. So, but I would say that we did come from that, and we did have some very specific models. I think it's the next step of, if we want to apply that to the United States, how do we do that? And I don't think we got there because it's pretty complicated.
But it also gives you language for which you can begin looking at the role of regulation as it applies in labor market and licensure and accreditation.
Right.
And that.
And it also brought up the idea of the social investment funders, or the venture people who were interested in social capital or socially responsible investing, which is also something we haven't really talked about, but exist.
We had time for one more question from.
Thinking about Ock's comment of working and partnering with non-traditional partners as we've thought of them. I mean, we spend so much time trying to work with each other as professionals. And meanwhile, the whole world is moving so quickly, and I wonder if we're going to be left kind of standing still on this. We have Google being it's going to be one of the biggest healthcare providers, Apple, and these are companies that our institutions are all very close to geographically, and I think we really need to be thinking about that much quicker as we've talked about this timeline, You know, everyone is getting healthcare in a different way. They might be going to Walgreens or CVS. I mean, the physicians may eventually, and nurse practitioners might be alone in their practices with no patients coming to them. I mean, and this is happening so quickly. I really think we all need to turn up our, even though we're in organizations that it takes a long time to change, maybe we can let those traditional things stay there and talk and do whatever needs to be done, because, you know, we don't want to disband all of that. There's too many people that don't want to do that. But we also, you know, we can have two time frames going on. I think we need to think in that way. We need to be thinking much differently about moving quickly, because it is going there and we'll be left behind.
And in the best tradition of quality improvement, bypassing opposition and being disruptive. So I think we're at the last element here, and we've got some things that we want to show the model one more time. These are next steps, but can you move on to the model, Megan? We need.
We just wanted people to know how we modified the model even from this morning. Great. We just wanted people to see how we'd incorporated changes from this morning. So, you know, acknowledging Ock's comment that our title was a little off, but anyway, actually we'd changed it before. Discussion around, you know, a value model for economics, so that we're trying to capture both the fact that this is about the economics and that it's about creating value. And so we also changed it to across the learning continuum to really reflect that this wasn't just the foundational education, it included, you know, lifelong learning. So on the next slide, we really liked the, you know, the suggestion of sort of creating different categories. So the foundational categories of the, you know, values that were guiding principles that we're trying to live up to versus the operational piece. And on the on the operational side, adding interprofessional to interconnected. So really working towards integrating that. And then on the third one, we added a point that was made right after our session was that we didn't have labor unions on there, huge actor in many places that will really affect our change, ability to affect change. And then reflecting that it was health systems and community services, so that we were making sure that we were acknowledging that boundary spanning health profession. So those were the changes that we made even from this morning, and wanted you to see the real time input that you had. And so if there's any quick amendments, happy to put those on the fly. Patricia.
Did you add under the prevention, did you add the health and well-being? I noticed this morning it still said prevention down there in terms of your mismatch.
Oh, we didn't modify those slides.
Okay.
This was really about the guiding principles
No, I
and the
understand.
actors. Yeah.
Yeah,
so-
but we had put that in as early input, so it
Yeah.
wasn't just medical model driven.
Right,
Right.
it wasn't specific disease ribbon. I think I'm thinking about what the buckets should be for within actors, but a question I got from Brenda was, as we take this model out, the term actors is an economic model. In some of our communities, something like stakeholders or shareholders will play a little bit better. I don't know whether that is something, whether you could put a slash, but
Right.
as something else.
Great.
I would suggest that you have their commercial lenders. In the financial world, the word commercial has a very particular meaning. So I would leave that out. I would simply say investors and lenders.
Investors and lenders.
Yeah.
Great. Thank you.
Because otherwise you only stick with the commercial banks, and that's a very particular category.
Yes. Thank you. That's very helpful.
Any other last minute edits? And Patricia will include your comment about wellness.
Yes.
Probably many times.
Yes. The fruits of your labor. Thank you.
Good.
Great.
I think we're at close. You will notice that we're giving you 3 extra minutes. I want to thank Susan and Malcolm for their leadership. Thank very much Patricia, Megan, and Bridget. And I also would like to appreciate my co-chair and the members of the planning committee. This has really been special, and thank you all.